Hi, I'm Dr. Ptacek. I'm an addictionologist. And now we're going to talk about possible treatments for opiate dependence or narcotic dependence. If you saw the first part, you now understand why it's so hard to stop, why it's not simply a willpower issue. Because in addiction, the brain has changed, and we don't have the ability to just step in and change the brain like we can a computer. So, possible treatments include a 12-step program, Narcotics Anonymous, a religious recovery program. There are a couple treatments that are not addictive themselves. One is a pill called Revia, one is a shot called Vivitrol. And then there are two treatments that are in fact addictive drugs, but they're less addictive than the opiates that the addict is addicted to. And under the right circumstance, the right person who's trying hard, they can often be very successfully used. All right, let's talk first briefly about Narcotics Anonymous. 12-step program means it's a self-help program where you do the work yourself with the help of your sponsor. You go to meetings regularly, you call your sponsor regularly, he gives you homework, you meet at his house or your house or somewhere neutral, and you do work the 12-step program, step 1, step 2, step 3. Somehow working that program helps reprogram your brain somewhat. Now, it doesn't cure the addiction. None of the things I'm going to talk about in this talk cure addiction. They all treat addiction. So they're similar to giving insulin to a diabetic. You're treating the diabetes, you are not curing it. All right? Now, so the 12-step program is probably responsible for more recovering alcoholics and addicts than any other treatment, quite frankly, especially in the form of with alcohol. I'm very comfortable that that is true. All right, that's the 12-step program. Now, secondly would be religious recovery. Two of the major ones that I'm familiar with we have in my community are Most Excellent Way and Celebrate Recovery. Now, these are different from going to church on Sunday. Your minister on Sunday or your priest on Sunday is not going to talk about how to stay clean and sober. But they're similar in that when you go to church on Sunday, you worship God. Well, when you go to these groups, you're using that same worship, but using it in a way to try to help stay clean and sober. Now, many churches have their own program without a name. So if you go to the West Point Bible School, they may have Monday night, the West Point Bible School program specifically help people stay clean and sober. Now, we talk about religious recovery, briefly mention miracles. I very much believe miracles happen and God's active in my life, but I just need to tell you, that's not the way most people get clean and sober. Most people get clean and sober because they put forth the effort to work one of these programs, and for those that are lucky enough to have a miracle result in their cure, or treatment or cure, then they're just very, very lucky. But for most people, it takes work. All right. So, in a religious recovery program, again, you go to the meetings, they're grouped together, so it's not just NA, i.e. Narcotics Anonymous, but it'd be people with any form of addiction going together. I strongly recommend, if that's the method you choose, that you ask for someone to help you, someone who's been in the program, had some serious sobriety, and they may give different names to them, helper or whatever. They're not called a sponsor like they are in the 12-step program. Most of these programs have an 8-step program that starts with, obviously since it's a religious recovery, step 1 would be realizing that you can't control it, but that there is a God who can control it. Whereas in the 12-step programs, they use a higher power. And for many people, that is God. For some people, it could be Buddha, or American Indian, it might be the sun god. But the point is, the 12-step program is built in such a way that anyone who believes that there is a higher power can use it, whereas the religious recovery programs that I'm familiar with would all have God as the person that they're using to help them. All right, now, I wish that those two were enough. In fact, I have some patients who go to some of both. But in opiate addiction, in many, many cases, those are simply not enough. Why? Well, one reason is that when you come off opiates, you are dope sick. And that dope sickness can last up to 6 to 8 weeks if you're on methadone. A week for most opiates. Now, you might say, well, we'll go to detox first, and that's correct. If you go to detox first, and you properly detox, walk out, you should be through the withdrawal, or the dope sickness. But unfortunately, you're not through the next stage, which is cravings. Cravings can go on indefinitely because that's the addiction. That's the primitive brain saying, we want some opiates. So cravings can happen all day, every day, and unless you're treating it with some form. Third is that there is, for the average person coming off opiates, a significant period of time in which they have very, very low energy, and that can be as severe as the lady laying on the couch while her baby cries and she knows he's wet and needs to be changed, but she just doesn't have the energy to get up and do it. So that can be severe. Next is simply denial, and that is even someone who goes to the meetings and is trying to get better, their brain doesn't really want to realize how severe the addiction is and how hard it's going to be to stay clean and sober. I think of denial as the primitive brain's way of hiding the reality of the addiction from the thinking brain. Next is pure and simple recovery using those programs is hard work, especially going to NA. We try to have people go every day for 3 months and then 6 days a week for 3 months and on down to where they get to go in 1 to 2 days a week and do that the rest of their life. Again, remember, NA is not a cure for addiction, it's a treatment. You know, that diabetic on insulin doesn't take insulin for 6 months or a year. She takes it the rest of her life until we come up with a better treatment. Lastly, when it comes to youth especially, they think they're invisible. Even us old people. Some can vaguely remember that point when we were young and we thought we were invincible too. And so it's just really hard to get them to believe that they're going to have to do all this work to stay clean and sober. All right, so what else is available then? Well, first of all, we have 2 medicines that are not addictive. One is a pill called Revia and one's a shot called Vivitrol. They both are a drug, naltrexone, that are blockers. Both the forms, the pill or the shot, both have the naltrexone, which is a blocker. Now, what that means is that if you take it before you go use opiates, it goes to the opiate receptor and binds, and then later when you use an opiate, the opiate can't get on. So the opiate just circles and circles until your body gets rid of it. If you take either one when you're actively using opiates, then they will make you very, very sick. But if you stop the opiates, like for instance go to detox, and then take this pill or this shot, then they don't put you in withdrawal because you're done with that. They simply are there available. Now, they don't treat cravings, they don't give you energy. All they do is they act as a backup. So they're like the screen behind a batter. If the catcher doesn't catch the ball, it hits the screen. The screen doesn't throw it back to the pitcher, it just sits there for the catcher to go get it. Well, that's like these medicines. They prevent you from using for a period of time. Now, the pill works for a day or 2. So if you took your Revia this morning and this afternoon in a fit of anger, you swallow some more tab, it's going to be like swallowing sugar pills. The shot lasts for a month. That's even better, obviously, because it means that multiple times during the month you give up and say, heck with it, I'm going to use. The shot's still there to protect you. But both of them at some point have to be renewed, whether once a day with the pill or once a month with the shot. Now, the pill can damage the liver, and so if you're put on it, you need your liver checked in less than a month before you start the 2nd month supply. I've never had to take anybody off of it because of that, but it could happen. The shot can hurt, usually doesn't, but especially if it's given in the fat instead of the muscle. And the shot does absolutely have a risk of getting infection in that side. And I have one dear sweet lady who's gotten an infection there and had to have several surgeries where they went to drain it. Now, that sounds really horrible, and I feel sorry if you were to decide to take it and have a complication, but never forget for a second that if you went on the shot, you went on the shot to stop the opiate addiction. And opiate addiction can lead to death from overdose, death from infection, jail cells, loss of your kids, loss of your job. So again, you're trying to treat something that's really severely horrible with something that has significant potential side effects. You just have to make the decision, of course. So those are non-addictive medicines. They're blockers only. They don't give any buzz, any rush, any high. They don't block cravings. They just are a backup. All right. Now, the next step would be, if you try those and you're not successful, or if you decide you don't want to try those, would be to consider an addictive drug. Now, that sounds crazy. Why would I trade one addiction for another? But these are both opiates. And the reason that they may work for you is because they give less buzz, less rush, less high, and therefore you may be able to take them properly instead. Methadone's the number one, and there are close to 200,000 people in America on methadone. Some of them doing well because they're there for the right reasons, and some of them simply there because it's cheaper drugs and gives them more money to spend on cocaine and other things. So hopefully the people in the methadone clinic that run it are trying to sort through the ones who are there for the right reasons. Now, you're shaking your head and saying, no, I would never, have somebody I love go on methadone. Let's stop and think about it. You have a 25-year-old daughter who's an IV drug user. Every time that she shoots up, she risks infection of the skin, of the heart, of the bones. She risks dying of an overdose from the drug itself. The way she gets the $200 a day to buy her OxyContin to shoot IV is she works as a high-powered prostitute, an escort. And so she risks getting AIDS, hepatitis B from that. She risks getting arrested buying her drugs or prostituting. She risks, if someone calls the state and says this lady is using drugs and they come to the house and her urine indeed is positive, the state can take her kids away. So between death, prison, loss of kids, it's pretty severe. Now, if that was your daughter and all those bad things were happening in her life and you were able to instead put her in a program that was legal and she stopped all the other drugs, stopped prostituting, was now able to take care of the kids, I think you'd be pretty hard pressed to say that that was a negative. All right. So, methadone, I believe, is the last ditch ever. I believe it's the very last thing that you use when nothing else has worked, because it's far better than going to prison or dying of an overdose or all the other bad things that can happen. Why does it work? Well, you dose only at the clinic. You don't get takeouts initially. You have to earn those over time. In a methadone clinic, you have to go to counseling. You have to go to group therapy. If you don't, you'll be let go from the clinic. You, at many clinics, can take no other addictive drugs. Some of them will say, well, you can take this medicine if it's prescribed by a doctor. In my clinic, I'm very strict about not wanting you on any addictive drugs, but there is some variability. So you've got incentives to stay clean, and that is if you start getting takeouts and you don't have to go to the clinic every day and then you relapse and have a dirty urine, you lose the takeouts. You've got an incentive that way. Secondly, you know that you're going to have to give urine samples any day the clinic says to. You have to give them in front of people, which is hard to do. And obviously, if your urine's clean, then things continue to go well. So, someone in the program who's at a methadone clinic is going to sessions, going to treatment, has incentives to stay clean. It's much cheaper. They're not cheap. $11 to $14, for instance, per day, are the prices in Pensacola, so $11 to $14 a day. But before my patients come into it, they were spending anywhere from $50 to $200 a day, so it's much cheaper than addiction. All right, now, what's the negative part about it? Well, it is still an addictive drug, absolutely. Secondly, it's very time consuming. You have to go in, sit, wait your turn, get dosed. It's expensive, wear and tear on the car. If you stop cold turkey, you will absolutely go into withdrawal, because remember, it's an addictive drug. And in fact, the withdrawal from methadone is 6 to 8 weeks, whereas the OxyContin would only be 7 days. So why would you do it? Again, you do it when it's the last ditch result. And I believe you do it when you're prepared to stay on it the rest of your life. There are some people who are able to get clean, and that's a whole other story, and stay clean, but I think that's the minority. I think the majority of people who come to the methadone are going to do well because they stay on the program. All right. Now, the last one is buprenorphine, which is, again, also an addictive drug, but it has benefits of being able to be taken to the doctor's office, and you go once a month. In the next tape, we'll talk about that at great length.